Today, we're welcoming representatives from the Washington State Department of Health to discuss upcoming changes to the food code. If you have any questions, we will repeat this information. Please feel free to type them in the Q&A section below. There will be some time for some of them. Also, we are recording today's webinar and we will post it to both our YouTube channel and will be available as a podcast. And you can get that wherever you get your podcasts. We can't forget to give a special thank you to Harbor Food Service for sponsoring this webinar today and for sponsoring our Quick Bites videos that you can find at wahospitality.org. And now I'm going to hand this over to our Senior Director of Communications, Andy McVicker. Good morning, Andy.
Good morning, Lisa. Thank you for that introduction and to the members joining us today. Again, my name is Andy McVicker with the Washington Hospitality Association Communications team. Thank you all for joining us for today's webinar. Again, another housekeeping reminder, it is being recorded, so feel free to check it out on our website in the YouTube channel if you need to leave a little bit early or you missed something in today's presentation. We'll have a recording up on our website and our YouTube channel. That's also where you can check out our Quick Bite series, which is what this is also covering this topic on the food code changes. Be sure to check that out on our website, Quick Bites, also on our YouTube channel as well. We'll post a link to that in the chat for today's webinar. Again, this is your time for the next hour. We want to make sure we get to your questions that you have for the upcoming changes to the food code. So please use the Q&A in the chat feature to ask your questions throughout, and we will get to those, as many of those as possible. So now I'll introduce our guests today. We have Samantha Lauterbach on our Senior Manager for the Government Affairs team for the Hospitality Association. We also have Joe Graham with the Department of Health, Food Safety Program Manager. And our featured speaker, who will be doing much of the talking today, is Susan Shelton, who you may recognize from the Quick Bites videos as well too. Susan is a Food Safety Program Health Advisor with the Department of Health. So now I will kick it over to Susan.
Great. Good morning. Thank you very much, Andy. We're excited to have everyone in the room today so we can all talk. And like Andy mentioned, please feel free to ask questions as we go through. We wanted to provide today a couple of updates with our food code changes and have some slides that we are showing on the screen now. So again, please feel free to put your questions into the Q&A and we will make sure they get addressed as well. So again, want to also mention that we also have a website with the Department of Health that you can access quite a few of the materials. We are still updating our materials that we'll be talking about today. However, if you go to doh.wa.gov/food rules, you'll be able to link to several of the materials on there. We have copies of the revised rule in case you want to read them more thoroughly. We have some of the historical documents that we used. So you can track changes, you can look at additional materials, the significant analysis, anything along the legal sides of the changing food code you can look at on our website. We did start this process back in 2018, anticipated it would be a couple of years. So, with an implementation date in 2020, and then because of the COVID-19 response, we did extend it. And so we're looking at an implementation date beginning in March. And we'll talk about that a little bit more as we go through. So again, you can look for materials on our website at doh.wa.gov/food rules. I wanted to also highlight, there are a lot of changes in the food code. All of them, have a variety of impacts. So I wanted to kind of give you a little bit of a rundown, a little bit of an overview of how they affect the different types of food establishments. So the key changes that we have that affect all, we have several that are going to be required changes for everyone. And we'll talk about quite a few more of these today, but just to highlight them, we have a verifiable health training requirement. What that means is that employees have to be trained on the symptoms and the illnesses that they have to report that they can't work in a food establishment with. We also have a new requirement. It's a written vomiting and diarrhea cleanup plan we'll be talking about today. Also, there are a couple of new diagnoses that we need to make sure that employees are aware of that they need to report to their manager. That's norovirus and salmonella bacteria. We also have a new provision for date marking, which is where you're looking at cold foods in your refrigerator that you store them for more than 24 hours. that you actually have to put a date on them and use them within a week. Also, we have some changes to soap and sanitizer availability that we'll be discussing. Also, a few tweaks to the inspection report, and then an upcoming requirement for the Certified Food Protection Manager. So those first ones are going to affect every single food establishment they have in Washington. However, in the ones in the middle, we have some that affect a few food establishments. So if you have shell stock, so oysters, clams, mussels, and they come inside the shell, you know that you have a tag that comes with those. If you have those products, you're going to need to write the tag, the day that you open the tag, as well as the last day, the day that you open the bag, as well as the last day that you serve from that bag, and write both of those dates on the tag. Also, if you cook scrambled eggs, hamburger, sausage, those ground meats, you're going to have to raise the cooking temperature up to 158. If you handle fish in the raw state, we have to worry about cross-contact allergen transfer. So if you have those products, we'll talk about making sure that you wash, rinse, and sanitize cutting boards that also touch raw fish. Also, if you have vacuum packaged fish, we'll call it roped, which means reduced oxygen package. It's a vacuum package. If it's labeled keep frozen, you've got to make sure you thaw that safely. So that, again, that's going to affect a certain few food establishments. And then the last group are going to be new options that you have. One of them is the ability to refill reusable containers. Maybe you have customers that want to bring in a container that they want to have you refill. So there are going to be some options there in case you want to do that. Also, if you want to have fresh fish, so salmon, halibut, and you want to partially cook those on a customer's order, you can do that with the new code. Also, maybe you want to have pet dogs inside of your facility in some scenarios, or outside in an outdoor area. We have some options for that in this code as well. And then also, if you want to donate foods, we have a few new options in case you want to donate foods to other groups. And then also, if you have an emergency operating plan, you can actually operate when you have a short-term water or power loss. So again, just as a quick overview, I want you to realize that there are a lot of options inside the new food code changes. Some of them are going to be requirements for everyone. Some are going to only affect a few operators. And then some are going to be options in case you want to do it, but they aren't going to be requirements for you. Going to tell you, one of the biggest things that we're doing now is what we call the educational period. So as I just mentioned, the new code does become effective in March. It was an extension that we did back in 2020 because we thought that would work us through the coronavirus and the COVID-19 response. However, that extended a lot longer than I think a lot of us anticipated. And so we're going to extend it a little bit longer. So while the code is effective, we've actually requested, both with the State Board of Health, with partnership with the Hospitality Association, with other partners as well, local health. Additionally, is that we're going to do an educational period starting on March 1st. And so what that is going to do is give us additional time to continue to provide training. So when you're talking with an inspector out in the field, or when they're coming in to do your routine inspection, they'll inspect for the current code, the one that we have right now, but then they'll also be educating on the upcoming code, the new provisions that are going to be required. And we think that time inside the field, so inside your facility, will be a good time for you to ask questions if you have them, also for them to give you additional education. So we'll be working on a continued education throughout this whole educational period, again, from March 1st until the end of August. So we're looking at enforcement beginning on September 1st, 2022. What I'm showing here on the screen also is the guidelines that we've drafted for this. So this is an official request from Department of Health. So this will be in writing, and so it will have something that we're all on the same page with. Again, I want to encourage you, if you have questions or anything along the lines, please feel free to ask.
Yeah, thank you, Susan. I'll jump in here real quick too, and just to provide a little bit of context. This is new information. This is sort of breaking news that we're announcing to members today. If you watch the Food Code series or been reading up on the changes leading up until now, the original implementation date was going to be for enforcement was going to be March 1st, and so just recently the Department of Health created this educational period to make sure that operators have some additional time, a longer runway on ramp to get on board with the food code changes. So a quick follow-up question on that one. You touched on this a little bit, but so in light of this new educational period for the next 6 months, we know that not every single operator is going to get a visit from a local public health inspector in the next 6 months. So what can they be doing what would you recommend an operator who may not have a visit from a local health inspector? What would you recommend they do to make sure that they're compliant over the next 6 months and then beginning on September 1st?
Perfect. So I think a lot of the education that you're hosting here is really, really valuable. And so facilities, food establishments, I'm hoping that they're watching the videos that you've produced so they can go, oh yes, this applies to me, this applies to me. They can reach out to their county health departments and say, hey, I need to have additional information. I have some questions. They can review the materials that we have on the website. They can also, go through it and just prepare and maybe reach out to others that do similar work to make sure that they're like, okay, wait, these things actually do apply to me. We're also encouraging the county health departments to do outreach and education as well. So look for the materials that you're getting from your local health department. We have, brochures, some additional educational items that they can share with you also. So yes, we recognize not everyone will be potentially inspected in the next 6 months. But again, this is giving everyone a little bit more time. The counties will be reaching out with education. We'll be providing education as well. But then food establishments, so restaurants, can actually reach out to us also. They can put in questions that can get answered. We can, continue to try to do additional maybe webinars coming forward. But again, it's going to take everyone working on this. So just because you don't get inspected in the next 6 months doesn't mean that, you're kind of like, oh no, I don't have to do this until I get inspected. I want to make sure everybody's like, oh no, I'm going to start. I'm hoping that I have my inspector coming because I have some additional questions, but you can also ask your questions. Even if the inspector doesn't come in, you can reach out to your local health department. You can reach out to us. We can help kind of assist you with any questions that you have. So, beginning in March, the education period starts, but please make sure that you start preparing your establishment too.
Yeah, Susan, I think this is a great just point to note that due to COVID, our local health jurisdictions and our industry have been severely impacted. The food safety teams at a local health are experiencing over a 50% turnover rate. So this time period that DOH has granted is going to be so important for our industry to get back into food safety and that focus, making sure that we're developing these new relationships with these new inspectors that I think we'll have and we know we're going to have. And I think this is just something as a reminder to give each other grace on both sides. Our industry is facing while the last 2 years have been terrible, we are facing a worker crisis and shortage. We are buried in debt. We have so many things going on, and there are a lot of emotions. So on the enforcement side, recognizing that, and then for our operators, recognizing that we're going to have a lot of new inspectors. So to ensure that you're giving them grace, ask the right questions. This is the time in the next 6 months to really develop that relationship. So if you do have a question, you can get it answered without any fear of retaliation. I know that that's something that we hear often, and we want to make sure that we're building that partnership. So just make sure that the next 6 months you are working on getting this up and running in your establishment, and ask the questions. Don't be afraid to ask the questions. And if you are, reach out to your territory manager. I am happy to assist in any of those conversations.
Yeah, and it is really helpful because Samantha is very good also about bringing them to us so that we can reach out to the counties. We meet with the counties once a month. We're definitely going during this education period saying, okay, talk to us about what you're seeing out there. Where are we having gaps? Where do we need to actually provide some more education, some more materials? And so we're all going to use this as a time to actually go, how can we meet this? How can we make sure this is working for everyone? Because as Samantha mentioned, we have a lot of change over the last couple of years, both at the restaurant side and as the regulatory side. So we're definitely all trying to work on this together and make sure we're able to implement this. So really is a key time to ask questions. And that's probably a good answer to your question, Andy, is like, what am I going to do to get prepared? If you have questions, please ask. Know that there are a lot of us. We've asked the counties if they get questions from their restaurants during inspections, so they bring those up to us as well. So we can go, let's make sure we're getting this message across the whole state, not just one-on-one. We're going to try to make sure we're getting this message across. So perfect. So this is our educational period. Again, it's going to be a time for ask questions, to discuss the changes to the rule that we'll be talking a little bit about today. But then the enforcement will begin on September 1st for these new provisions. I want to make sure I'm clear on that too. We have a code that we have going on right now. So if you have something going on that's in the current code, and there's an issue that they need to get correction, that will still be the same. You will get corrections for those. All right. So this isn't just a carte blanche for the next 6 months. It's like, no, you'll still be evaluated for those, but then the new changes, you'll be have a little bit of a grace period, as we've talked about. Keep trying to get focused on them, because again, if you start trying to implement them, that way it'll help you identify if you have questions going forward on how to actually do it correctly by the time September rolls around.
Real quickly, Susan, we had a couple of questions come in. Just wanted a clarification. Did you say, will the new changes be mailed out to food operators, or is this something that folks should be going to the DOH website or their local health department website to be finding out these changes?
Yeah, so I don't think you're going to get a copy of all of the changes. They're available to you on the website, so they are definitely available for you to actively go out and search. Some counties are offering, they send off, if you're listed on their email, they'll send an email update. Every county is a little bit different with how they're doing the outreach. On our side, you could get it off of the website, and you could actually go through it that way. We also have and I'll share this address at the end. It's a listserv that you can join, and that way you can get updates from our office. And then we'll also share as soon as we have all of our materials all in line too and available publicly. We'll share that with the Hospitality Association so that I can actually share that information also. So ultimately, you're not likely going to get something in the mail. It's probably going to be something that you're going to need to do, maybe do a little bit of active reach out either to your health department or online. Did you have another question, or was that the?
No, yeah, you can go ahead and.
Perfect.
Yep, go on. We'll get to some questions later too.
Okay, great, thanks. So I did want to highlight 10 of the key changes that we get most of the questions about, and this affects the vast majority of the food establishments. So we wanted to cover these top 10. This is an example, though, of a brochure that we have that does kind of go over some of the highlights as well that we can share also. You'll also potentially get it from your local health department. So again, we're going to highlight the top 10, and hopefully this will also spark some questions from anyone that wants to ask a little bit more. So let's start off with our number one. It's the Certified Food Protection Manager. The Certified Food Protection Manager is a new requirement in the Washington State Food Code, and it's been an option for quite a while. It's been in the federal model for a while, but it's a brand new requirement that's going to be effective. And what a Certified Food Protection Manager is, it's a food safety program manager from one of the 6 accredited programs, and these programs are accredited by ANSI and the Conference for Food Protection. So it's one of these programs that we have listed right here. Again, there are only 6. Several of you might have them, or at least one certified food protection manager inside your food facilities. What's going to be unique, again, is that it's going to be a food safety manager, and it's going to be ANSI approved. So again, there are 6 of these accredited programs, and these are the only ones that are accredited. Now let's talk a little bit, since you've seen the courses. It's a food protection manager program. It is going to be provided by one of these 6 providers, and that's what's going to meet the certification requirement. So let's talk about this one a little bit more for Washington State. So what our new code is going to require is that at least one certified food protection manager is going to be associated with the establishment. And this is going to be an employee per the establishment. So let's clarify that a little bit. You're going to have at least one person that is a certified food protection manager that is a contact for you. They could be one of your managers, they could be one of your employees, but they could also be maybe a contractor that you have an association with. It doesn't have to be somebody that's on shift. It doesn't have to be somebody that's inside your facility at all times. All right, we've changed that in Washington State. It just has to be somebody, it's an employee that's associated with your establishment. So again, that could be a contractor that you have. Maybe you have 4 different locations, and you have one person that is a certified food protection manager. That certified food protection manager, that person with the certificate, could actually be the certified food protection manager for each of your 4 locations. Okay, so you can have one per quite a few different locations as well. Again, the person does not have to be on the premises. That's a change from the federal model. If you're familiar with what goes on in other states, this is another requirement in the federal food code. In other states, it's required to have one certified food protection manager on shift at all times. Okay, Washington totally changed that. So again, you don't have to have that individual on the premises. It can just be somebody that you actually contract with. The certified food protection manager ultimately is responsible for making sure that your persons in charge are trained. So your managers are trained, they understand their requirements. Also to make sure that you have any written plans, that they're written according to code. So again, this person is really designed to help you make sure that all of your managers that you have on shift actually understand the code, are able to follow the code, and are able to have the materials that they need. Now, here's one of the biggest changes. We've talked a little bit about the educational period. Even when we wrote the changes to the food code, we put a delayed implementation for this provision. So what does that mean? It means the certified food protection manager requirement is not effective until March of next year. So March of 2023. Okay, so we've talked a little bit about a staggered implementation. We've got the educational period until September. You have even longer for the certified food protection manager requirement. Hopefully that gives you time to go through and go, okay, here are the courses, here are the certificates that I potentially would need. I'm going to identify a person that has this, and then I can be ready for that come March of 2023. And then if for some reason you have a certified food protection manager, Samantha talked about how we've all had a little bit of turnover. Maybe that certified food protection manager leaves, next year sometime, you would have 60 days to replace that individual. Okay, so again, this is another change. It doesn't become effective until March of 2023. We have these specific 6 certifiers that you can actually use. Know that each of them has a different ability. Some teach in person, some teach online, some have additional training material, some have a variety of languages. Some have different ways that they can offer you the exam. Some people want to take the test in person. Some people want to actually do it on the computer, so virtually. And each of them have a little bit of a different option for how they can provide the certification. It's going to take some time, though, if this is not something that you routinely offer inside your restaurant, or if it's not something that you have access to. So again, we want to make sure that you realize this is effective in March of 2023. It's going to be every food establishment is going to have one, at least access to one. It's going to take a little bit of effort for you to identify one if this isn't something that you normally have inside your business. Any additional questions on the certified food protection manager? Okay. Okay, so let's go for number 2. So again, the certified food protection manager, that's going to be a requirement that begins in 2023. You have to have that certificate. And again, what you would need is just to have the certificate posted. And if we needed to reach out to that individual, we would reach out to them separately. Now, they don't have to be there during the inspection. But ultimately, what's really needed is that your businesses have what we call active managerial control. And active managerial control is where your person in charge. So again, we call it the person in charge in the food code, but you might call it a manager or a supervisor that's on shift. We're going to call it the person in charge. That individual has to have managerial control over the food establishment. And so that means that they are proactive, that they are looking for foodborne illness risks, that they are working with staff to make sure that the tasks they're doing it correctly, that temperatures are correct. People have oversight. They're actually looking for things, and they're actually verifying that everything is working fine. This is a preventative approach. Sometimes when we go into food establishments, we'll take temperatures and the temperatures will be off, and it's a surprise to the manager. All right. In general, that shouldn't be a surprise for you. It shouldn't be a surprise if your refrigeration's off when the inspector comes in. Want to make sure you're doing very similar to work to what the inspector does, looking at temperatures, watching for hand washing, making sure that foods are cooling down correctly. This is what we call active managerial control. And so it's one of the key components in the code. It's always been the concept behind the code. We just defined it in this code and said what it is that it means you're being preventative. You're proactively looking for food safety risks. We're really going to focus on this. And so we're working on a toolkit. And this is a screenshot from one of the toolkit documents to help you evaluate if you have active managerial control. If you do any of these processes, are you looking for ways to actually make sure you're controlling the risk? So it's going to be something that you're going to want to evaluate whenever you look inside your facility. Some of you might do a self-inspection. That's an example of active managerial control. All right. So again, this is going to be a key component. If we find that you have potentially where you have a temperature that's out of compliance, maybe you have a cold holding unit that's down, we're going to talk to you about that and mark that on the report. And then if we come back and it's the same violation, we're like, well, now we have a concern for active managerial control. It's got to be something that you have to do on a regular basis. All right. Whenever you're working in food, we want to make sure you're actively looking for risks. So it's a big component. It's always been the concept behind the code. But again, it's now defined in the food code. Another highlight that I want to mention is you might wonder, well, how are we going to train all of the staff? So you have training responsibilities that you have for your restaurant, for your food establishment, that talks specific things for the menu that you have, your customer service, all of that internal training that you do. We also obviously have the Washington State Food Worker Card training that is also being updated with the new code requirements. We have a new Washington State Food Worker Card booklet. These are some of the pages from the booklet. This will be downloadable. These changes are going to become effective and posted in March. So you'll start to get, when staff start going in for their food worker card beginning in March, they'll start having the updated materials as well. So again, your staff that get their food worker cards renewed after March are going to have the new information and the new materials. So if you have food workers that have a current card, it hasn't expired yet, they don't need to go in and get the new training, but just know that that's when the shift is going to happen. So you might have food workers that are there now with you, and they're going to be trained on the outgoing version of the code. And then if you get some new workers starting back, in March or April later this year, they're going to be trained on the new materials. And again, these documents are going to be available to you. We're having them translated now in multiple languages in case it's helpful for you to have multiple languages. They're going to be available so that you can download and just use the sheets if you'd like to use the sheets from the food worker card manual.
Susan, just a quick question. Over the last 2 years, our operators have been focused on many things, including food safety, but COVID controls as well. And so I think this is a good reminder that we need to get back in and focus on some food safety practices. You mentioned a self-inspection report. I know that some local jurisdictions have this, but not all of them, just due to the nature of a small local health jurisdiction. Does DOH have this available on their website? And if not, could we get that available for operators so then they can start during this educational process?
Yeah, and that was one of our big items for our timeline too, to actually develop this, what we call the active managerial control toolkit. And we're like, one of the key components of that is actually to do a self-inspection. So yes, it isn't available yet. We're trying to get it posted and get it available, but it's going to be in concert with all these other materials, because we agree, it's like you need to have these materials to kind of start off. And so some counties will offer it, but this would be something voluntary you could just do on your own. But yes, we have a self-inspection. It asks you questions along the lines of, how often you monitor, when's the last time you talked with workers about employee health? I mean, just kind of those kind of concepts to get that to front of mind again. We realize there are a lot of things that are pulling managers right now. So we wanted something in writing as well. So yes, we are drafting a toolkit, and it does include a self-inspection concept. And it also can be manipulated and changed based on what you do inside your food facility. So it's designed to work for you.
And a follow-up on that, Susan, is it a requirement for an operator to keep a log, the self-inspection, or for?
No.
Okay.
And so the only time it's going to be a requirement is if during inspections, they find it's a gap. And then it's what we call a risk control. It's like, well, wait a second, we want to make sure you get this permanently corrected. So sometimes if they indicate that, we're having difficulty with employee training, they might say, okay, now for the next 30 days, you're going to have to keep a log of this. So sometimes it's a reaction to an inspection, but no, in general, you aren't required to do this. It's really designed just to evaluate yourself. So you can go, yes, this is working for me.
Just a couple questions in the chat, but one I wanted to address for Jerry around, will ServSafe be updated by March 1st? These programs, these ANSI certified programs are accredited by the national program and system. So they are oftentimes are training our PICs and food protection managers on more of a more strict food code. So those will be up to date. They will not be specific to Washington State. None of the programs will, because they are accredited federally, and we do, and most states have a separate food code than federal. So great question. That is a little nuance. And Susan, there is another great question, which I had not thought of. Does the food protection manager need to keep an updated food handler's permit? As we know, our program doesn't require a food worker to have it. It's just someone who's connected with the organization. So that's a great question I hadn't thought of.
Yeah. And that is a question that we've gotten. And I kind of want to dial back on the first one you answered too. And that's what's kind of really important with this. ServSafe is already using the same FDA food code that now we are adopting in Washington State. They've already been updated. As Samantha mentioned, we have a couple of tweaks that are unique to Washington, which we can highlight here. But if you have the ServSafe, you'll understand the general principles of what we're trying to reach in Washington State. We adopted the most recent copy of the food code, which ServSafe is already based on. And then, yes, in your other example, we have a requirement for all food workers to actually have that Washington State food worker card. So even if they have a ServSafe or other certificate, they need to also have the Washington State food worker card. Here's where that certificate's going to help you, though, because if you have that Certified Food Protection Manager certificate, your food worker card, when you get it renewed, will be good for 5 years. That's usually how it helps you. So it'll extend the life of your food worker card. Okay, so let's dial that around. So my example where I said you have somebody that is just a contractor for you, they don't actually handle food for you, they're just there to help you understand the code. They're your Certified Food Protection Manager, but they don't really work inside your food establishment. They wouldn't need to have a food worker card, right? But if that person also actually handles food for you and prepares food for you inside your facility, they need to have a copy of a food worker card there.
Okay, so like an example would be if you have a training HR, a part of your business, and they do most of your employee trainings, including, they would not, if they were your food protection manager, they would not need a food worker card because they're not in the day-to-day operations serving or preparing food.
Correct.
Okay,
so let's look at the cleanup of vomiting and diarrhea plan. So this is a brand new one, and this does come from that federal model code. So if you take ServSafe, it'll talk to you about the cleanup of the diarrhea and vomit cleanup plan. So we wanted to highlight this one because, again, this is going to be a requirement for everyone. We realize this is something a lot of food establishments may already have, but a lot of facilities do not have. So we prepared a sample document. And this is a Word document that you can go through, evaluate, adjust to fit your food establishment. It highlights steps to take to protect your customers, to protect your food, to protect your surfaces, so how to clean, and also to protect your employees. Because again, whenever you're cleaning up diarrhea and vomit, you need to make sure your employees are protected as well. And so it also talks about how to train your staff, or it gives you some guidance along those lines as also. So there are multiple documents that are available on the web. Again, we'll have this document available. I'm hoping that we'll have it posted live and available next week so that you can actually use this one also. We've sent it out for comments and gotten quite a few comments, and it seems to work for people pretty well. Again, the concept behind it is just to make sure you've evaluated your food establishment for how you would do the cleanup. You know, we've actually had outbreaks of linked back to when like a consumer or a customer or an employee vomits inside of a food facility because people walk through it, or maybe it gets onto the surfaces and it wasn't cleaned and disinfected correctly. So want to make sure it gets cleaned up. We think it's a rarity. We don't think it's going to happen often, but we want to make sure you're prepared in case it does happen inside your food facility. Should be a relatively, it should be something that you can kind of go through and just evaluate and say, yes, this will work for us. And then you have your kit or whatever you need to actually do the cleanup, train your staff, and then that way it can work for you long-term. So again, this is a new requirement. It does have to be in writing. Doesn't have to be submitted to the health department. It has to be something that you have there on premises that we can review. Key thing on this one is that you want to look at your sanitizers or your disinfectants, the chemical that you use primarily to sanitize. What you're going to need to look for is something that is effective against norovirus. That's what we're trying to control here. So if you want to kind of get started on this, you can look at your sanitizers and look at it to see if it's labeled for norovirus, because that's the kind of disinfectant you're going to need to use.
Susan, I think this is a great little segue into sometimes the Department of Labor and Industries does not love the chemicals that the Department of Health like us to use in cleanup situations. Is there a list that the Department of Health will provide? Well, I know we have some already that say norovirus. It may be helpful for DOH to just list a few approved products that then perhaps our association can run by Department of Labor and Industries just to ensure any overlap isn't missed.
Yeah, so I think the biggest component with that is a lot of the chlorine-based ones require an eye wash, or they might have another kind of chemical kind of interaction. We can go through it more along the lines of here's the list that we would use, and then you could use that to evaluate. We are going to follow the EPA's list of disinfectants that are approved for norovirus. So EPA is the agency that actually reviews those and approves them. So we do have a list, but again, we get that from EPA, and I'm happy to share that. And I appreciate that you're trying to help kind of marry those two, agencies, because we've definitely seen it, where you have a chemical that works for disinfection really well, but it's also a potential risk for your employees if it's not used safely. So LNI has some additional points. Okay, so again, this is going to be,
sorry, just a real quick question. Since you mentioned the sample plan here, we got a question about when operators will be notified when the materials are available. I know for sure to answer that on our side, we put out the materials. We posted them on the association's website. We'll include them in our weekly email newsletter. If you're not a recipient of that, go to our website or contact us, and we'll sign you up for that newsletter. But then I know, Susan, you mentioned earlier, the department it's got a communication plan for getting this information out to operators, right?
Right. So we have a series of these right now that we're finalizing, and like I said, we're also going to get them translated. Several of them get translated. We're hoping to start posting these so that they're broadly available on our website on next week. So starting to post them there. And then the ways you could get notified, as Andy mentioned, we will share them with Washington Hospitality Association as soon as we're like, here they are. We will have them and we will share them immediately. So that's a great notification system. But then we'll also, if you want to join our listserv, we will also be updating people through email when we're like, okay, here these new documents are available. And then you can also, like I said, you'll ultimately probably also get them from your local health department.
Just quickly, I am going to add the link to our Quick Bites materials. That's where we will publish everything that we have on hand, including the videos that we've already done around the food code. There is a question of how to get included in the weekly. Of course, reach out to us after this webinar. I'll put my email address in the chat, but this is a great resource for anyone. I know that we are being joined today by the Brewers Guild and the Washington Wine Institute. We are happy to share all of our information with all of you. So please go back and check this site that I've included in the chat weekly, or if you have any questions, feel free to email us as well, and I'll add my email address.
Thank you, Samantha. So the next item doesn't have a big change, but it is something we want to make sure everybody's aware of. So whenever you have workers, we have a few illnesses that can actually spread from a worker through food or through utensils, through contact, that can spread from a worker into the food. And so we want to make sure that you're evaluating workers to make sure they're healthy to work with food. So I just want to highlight some times when we have inside of our code that you have to exclude a worker. And that means you have to make sure a worker that is either symptomatic or has a diagnosed illness is not working inside your food establishment until they've been cleared. All right. So these are the symptoms of if somebody has these and they're reporting to the person in charge, they aren't allowed to come in and actually work as an employee. They're not supposed to be working until their symptoms are gone. Classic ones are diarrhea, vomiting, and jaundice. All of your managers should know this. All of your staff should know this. I understand it's confusing right now because of COVID. They have additional symptoms that they're looking for. These are the ones we're looking for spreading through food. So diarrhea, vomit, and jaundice. On top of that, we also have diagnosed illnesses. So this is when they've gone to the doctor and the doctor says you've got Shigella or E. coli or hepatitis A or potentially salmonella or norovirus. These are illnesses also. If they get diagnosed, this means that worker, it has to be excluded. So you'll see sometimes where, maybe you have a worker that has Giardia. It's a parasitic illness that we can get from camping or from drinking water or from childcare or something. There are a lot of different ways we can get it. If they don't have active diarrhea, if they're feeling okay, they don't have active diarrhea, then they can continue to work. These are the diagnosed illnesses that you have to say, whoa, I need you to stay out of the kitchen. Right. So it's really important that you're aware of these. These haven't changed much in this rule. The only thing that they changed in this rule is that we added in all different types of salmonella. Before, we just had a couple of types of salmonella that had to be reported. So all different types of salmonella. And then again, if they go to the doctor and they get diagnosed with norovirus, that was also added. All right. So we want to make sure that you are aware of those, because this is going to be a new requirement. Okay. The new requirement is going to be that you have to make sure that your person's in charge, your managers, that they're able to verify that they have trained employees on this. So some ways to do that, you would have maybe a training sheet that you're like, we discussed, maybe when they were brand new, they got hired. Like we discussed the illnesses that you had to report. We discussed the symptoms that you had to report to the person in charge, to the manager, and then you have them sign it. Maybe you have a printout similar to what we've got right here. This is another magic example of one that we'll have posted. That you can post on the wall. It's like, yep, I've got it right here. It's publicly posted so the employees can see it here in the break room. Everyone knows, we show it to them. We're like, yes, here, I can tell you that this, I know what those symptoms are. I know what those illnesses are. Okay, so again, the big change for this new rule revision is making sure that you are talking with your employees about the symptoms and diagnosed illnesses that they have to report to the person in charge, especially the ones that keep them from actually being able to work until they've been cleared of those illnesses. Okay, so again, this should be something that you're doing now. It's something we do talk about in the food worker card, but again, it's something that you actually have to make sure you're verifying, that you can prove that, or you can show that you actually did also talk with the staff about these diagnosed illnesses or symptoms. Any questions on employee health?
We're going to save some questions, Susan, because we're running out of time just to move forward through the next changes, and we'll get those questions answered at the end. Perfect.
Thank you, Samantha. Okay, so number 5 is bare hand contact. So bare hand contact is prohibited with ready-to-eat food. And what does that mean? It means when you have, you wash your hands, you have bare hands. Usually, I think you're probably in the habit of putting on gloves or maybe using utensils like forks, tongs, or spoons. Because again, we want to make sure people are not transferring germs from their hands onto the food. But we wanted you also to be aware that the code does allow it in certain scenarios. You're allowed to have bare hands touching food when you're washing produce. You're allowed to have bare hands touching food if you're cutting ready-to-eat foods and then you're going to cook them there inside the facility. Then the third option that you're allowed to have bare hand contact is if you have an approved plan. This approved plan is going to require employee health, hygiene, and training requirements, and also some monitoring requirements. You have to have that active managerial control that we talked about. So we want to make sure you're aware of this. I know everyone's having some difficulty potentially with some of the availability of gloves or other kind of consumables. So you do have a couple of options. But again, if you're wanting to do bare hand contact inside your food facility, it has to be through an approved plan, which means a plan that you have approved by the local health department. And it's going to have to require some consideration for extending your employee health, hygiene, and training requirements as well. Happy to talk about that one more. Realize we may not, we just have that discussion, and maybe you want to reach out and ask questions if you want to pursue that going forward. But do know it is an option.
Yeah, Susan, I think that's a best question for your local health and health jurisdiction, due to the fact that you will need to apply for a variance. However, I did just want to highlight this for our members and our industry, that this was something that we requested. It was always allowed within the code, but a little bit confusing and hard to understand. So we want to say thank you to the DOH team for kind of pulling this out, making it more easily to understand on how to apply for that variance. And I really want to encourage those folks who were interested in this to try to figure this out during the educational period.
Yeah, this is another one that we've modified based on your request. We've modified an application that you could potentially use, and that'll help you kind of go, is this something that I want to do? So this will be another document that you could potentially review, see if it's something that you want to do for your food establishment. Next one's going to apply to everyone is date marking. Date marking is where you have cold TCS foods for time temperature control for safety foods. So that's a word change that we have in the new code. We used to call them potentially hazardous foods. These are the foods you have to keep hot or cold for safety. So when you get inspected or when we ask you questions, we're usually talking about things like your animal products, your cut leafy greens, your cut lettuces, your cut melons, cut tomatoes, all your cooked and cooled foods. Those are what we call TCS foods, time temperature control for safety. Brand new requirement in the code, and it's going to be date marking. What that means is if you're going to hold those cold TCS foods more than 24 hours, you have to put a use by date on them so that it's something that you're going to make sure is used within the 7 days. So you have 7 days in order to use those products. So this one might take quite a bit of thought process whenever you're looking at your menus, when you're looking at your refrigerators, your walk-in, your prep tables, wherever you store TCS foods for more than 24 hours, know that you're going to need to potentially put a label on those to say, okay, we need to make sure this is used within the 7 days. So what's key here also is that these are products that you either prepare in-house or that you open their container. Okay, so if you have a whole container of milk, it's a TCS food, it's an animal product that has to be kept cold for safety, but it's in a sealed container, you don't need to date mark that. But once you open that container of milk, then you're going to need to make sure you use that product within the 7 days, and you will have to date mark that. So this is another aid that we have to help with date marking. We have quite a few foods that are exempt from date marking. This has actually been in the federal model code for 30 years. We're just now pulling it into Washington state as a requirement.
Yeah, Susan, I think during the food code revision, we had asked the majority of our industry if this was something that they're already doing. It sounds like this might already be a well-practiced I guess, thing inside of our organizations. I think the one thing just to really highlight for our members here is to ensure that all of your all of your employees are trained on the processes that you have set up within your facility, so that when an inspector does come in and ask questions like, hey, when was that milk opened? Or if everyone on your staff understands that we mark it when we open it, or we mark it when we have to throw it away, one or the other. So just so everyone's trained within your facility.
Yeah, you want to make sure your process is consistent and it's understood and it can be explained to others. And so, yes, I think a lot of people do follow this because of quality, right? They've been doing it to make sure they're going through stock, but know that now we'll also start asking you questions about it. And there are a lot of foods that are actually exempt from this, even though you keep them cold in the refrigerator. So again, this document that we have will help you kind of highlight. I think one of the two biggest items that we'll probably talk the most about going forward are going to be cheeses, because a lot of those have to be marked once they're opened. And then also deli meats. That's another one that has to be marked once it's been opened. So that probably will affect quite a few food establishments. So let's talk a little bit about some of the food specific changes. We have some changes to temperatures. The biggest one is the raise of ground meat. So hamburger, sausage, ground meats. That also is going to include eggs that you kind of scramble for multiple people. So if you whip a whole bunch of eggs together, right now that cooking temperature is 155. When the new rule happens, it's going to be 158. Okay, so we raised the cooking temperature by 3 degrees. That was a USDA and it's a requirement. So again, that's something that we modified in Washington state. What that means is when you hit 158, that is the final cook temp. It's what we call an instantaneous temp. You know, right now, if you've cooked hamburgers a lot, we'll say 155 for 15 seconds. That means you have to hold that temperature for at least 15 seconds. The reason why we raised up to 158 is that's instantaneous. Once you hit 158, you don't have to hold it any longer. It's like, no, it's done. Similar with poultry, that temperature didn't change much, but they're like, that's also instantaneous. So for those of you that are familiar with the code, you know, it says 165 and hold it for 15 seconds. What that would technically mean is you need to make sure that food product stays 165 degrees and keep your thermometer in for 15 seconds to make sure it doesn't drop down. In this case, it's just like, no, that's instantaneous. Once you put the thermometer in, it says 165, that should indicate that it's done. Also want to mention a little bit, we talked about it briefly at the very beginning. If you handle raw fish, especially like on a cutting board, the current code allows you to cut fish on a cutting board and then put raw chicken on that cutting board and continue to go on. FDA removed that. They're just like, no, because fish is an allergen. We want to make sure after you cut fish on a cutting board, before you go and cut another animal product, you want to wash, rinse, and sanitize the cutting board. Again, I don't think that's going to be a big impact for a lot of food establishments. However, do know if you handle raw fish and you're used to using the same cutting boards with different meats, you've got to pull the fish off and actually wash, rinse, and sanitize the cutting board. Also, again, if you have vacuum packaged fish, say you buy commercially packaged fish, it's frozen, it's labeled keep frozen, know that you're going to have to break that seal when you actually thaw that fish. So again, it's vacuum packaged, it's shrink wrapped, it's got a tight plastic seal, it says keep frozen on it. Make sure you break that seal when you actually thaw it in the refrigerator or once you're done thawing it under running water. Again, that probably isn't going to impact a lot of food facilities. Want to make sure if it's something that you prepare that you're aware of it. Also, you're going to need a small diameter probe. So if you have thin foods like hamburger patties or fish sticks or things that are really, really thin, then you need a probe, a thermometer that actually takes the temperature in the tip of the thermometer. So if you use a dial thermometer that has, it needs to go about 2 inches into the food, you'll need to upgrade to probably a digital or something that actually takes the temperature in the tip. So when you get back to your office or when you get back to work, make sure that you're looking at your thermometer saying, yes, most digitals are already a tip sensitive. They take the temperatures in the tip. but do look at your thermometer very carefully if it's a dial to make sure you're able to take accurate temperatures with just the tip. That's specific if you have thin foods like hamburger patties, fish sticks, that kind of thing. Also want to make sure that, when you're dishwashing, you have a way to test the dish machine. So, usually maybe you're used to using a test strip with your sanitizer for all your wiping cloth buckets, but know that it is also applies to your dish machine. So if you use a chemical sanitizer at your dish machine, you need to have a test strip there, but you would also need to have a high temp test strip if you have a high temp dish machine. So your dish machine uses heat. So that whenever we do inspection, we usually run something through that to see if it's at proper temperature. Know that you are also supposed to have that, and that's in the code now. Also, you need to have soap and sanitizers available. Some food facilities, they'll do food preparation. They'll be making sandwiches, and they're like, well, I'll wipe this down when I'm all done. Know that the food code is like, no, if you're actually doing active food prep, you need to have sanitizers available and ready for your use. Then final one, and this was based on input from interested parties during our rule revision, is that the close grained woods, that those are allowed for salad bowls or allowed for cutting boards, that close grained type of wood. And we just clarified in the rule that you can use them for other food contact surfaces. So again, if it's close grained, something you're able to wash, rinse, and sanitize, you can use that for maybe a charcuterie board or other things as well for service. So we clarified that in the code. Now, let's talk about this one real quick.
We are running out of time, so I just want to maybe highlight the detail or the high level here, so then we can get to dogs in facilities, because I know we have breweries, and then we have some questions we need to get answered. So if we could just do high level here, and then we can circle back later, and then we could also showcase our videos to get into more detail.
Oh yes, perfect. Okay, so we'll highlight here. So one of the biggest things that there's an option for you. It is not something that you're required to do, an option. We had quite a few comment to have us expand the consumer-owned returnables. And so there's an option there if you want to have a consumer be able to bring in their own container to have it refilled. If that's something that you're interested in, it has to be under an approved plan. We have a plan form for that. We're happy to discuss it with you, but do know it is going to require an approved plan on your part, and also additional training and additional signage that you would need to do to allow that for your customers. So again, it's one of our top things that we received customer comment on during our rule revision process. It is an option that is open to you if it's something that you're interested in. And let's get to the pet dogs. So this is another one. We had a comment to allow pet dogs inside, or I'm sorry, in outdoor environments. So if you go to a food establishment, they have outdoor areas where people can eat. We wanted to open up the code to allow people to be able to do that. And so we have an allowance if you want to have dogs, pet dogs inside your outdoor areas. You can actually apply for that. So we have a sample plan that you can use. Got to make sure it's not in a food prep area. You can't do any kind of food work out there. You can serve food, but you can't actually handle any other food or do any kind of food prep out in the outdoor area. So that's something if you want to have, again, pet dogs inside or outside your environment. However, the legislature also passed a state law change. In particular, it was designed for microbreweries, but we applied it to other similar food establishments. So these are places that primarily just serve drinks inside of dishware. They use reusable glassware. And so they also serve drinks. So they don't really prepare food. They might do tastings, that sort of thing. Those can also have pet dogs inside if they're very limited inside their food establishment. So again, it's really going to be selected for indoors. It's going to be specific for businesses that really only do tastings, and they might have some, dry chips or something like that they kind of give for samples, but that's it. They don't really do any food work. So that one in particular, again, for the dogs and outdoor portions of the food establishment, you're going to need to have an approved plan. To allow dogs inside the food establishment, it would be something that you would notify your health department if you wanted to start that. Again, we have information on that one if you're interested going forward. And then finally, we also have a new change that just want to make sure you're aware of. We have a few tweaks to the inspection report form, but one of the new requirements, and it comes from the Federal Food Code, is that consumers, so your customers, are aware that they can actually review their most recent inspection report form. Most of our counties actually publish their inspection report forms online, And so what the counties are doing on your permit, you'll probably see where it's been modified, saying that you can actually review our inspection reports online. That's what most of the counties are doing, because ultimately what needs to happen is that the consumer needs to be notified that they can actually read a copy of their inspection report. It's always been publicly available. The FDA put in language to actually make sure that we're advising them of that. So again, if it's something that's on your permit, that'll work in general. Otherwise, you might need to have a sign, or at least notify your staff that yes, customers, our inspection report form is available. And like I said, the vast majority of food establishments post that information on the website, on their websites. I'm sorry, health departments post it on their websites. Okay, so again, just to make sure everybody's feeling good about getting ready, you want to make sure that you're aware that you need to have a certified food protection manager by March of 2023. Again, that's somebody that you have as an employee, doesn't mean somebody that's on premises. Make sure that your person in charge is proactive and has active managerial control. And figure out your vomit and diarrhea cleanup plan. Make sure that's written specific for your food establishment. Provide training to your staff, maybe update signage if you have any for employee health. Also make sure if you're interested in having bare hand contact, you do have options, especially if you have active managerial control. Samantha mentioned, encourage you to reach out to your local health department. Date marking is new. Look at your cold foods inside your refrigeration units. Make sure that they're marked if you're going to keep them for more than 24 hours after they've been opened or actually prepared in-house. Also, if you have,
While you're on that, I think we have a couple questions about that. Okay. So someone asked if everyone knows that that's the open date, do we also have to put the discard date on that product?
No, you only have to put one date on there. We just have to, like you mentioned, you have to sit there. We have to be able to ask if this says, so if you put an open date and it was 2/14, if I ask, I'm like, what does that date mean? And they're like, I think that's the day you throw it away. We're like, whoa, wait a second. That's confusing. So as long as your staff knows that's an open date, that'll work fine. You can use either the open date or the use by date. Only need one. Okay. So look at your, cooking hamburger temperatures. If you have oysters, if you have fresh fish, you might have a few specific changes for you. Also know that there are some options there about consumer-owned containers. It's an option for you. Some of your customers might request it, but again, it's not something that we're required. It's just an option if it's something that you want to have that kind of capacity. Know that you also have some options for pet dogs. Again, it's an option. It's not a requirement, but there are differences, whether they're indoor inside the food facility. That means you have a very limited menu. Pretty much you just do pouring. And then you can also have them in an outdoor environment as long as you have an approved plan. And then finally, know that your inspection report is going to be something that's always been a public document. We're going to modify the permit more than likely to say that customers can review that. And then do review it with your inspector. This is a great time, as we've mentioned throughout the discussion today, is when they do an inspection, make sure you understand all the changes that are happening. Make sure you have that communication. We really are trying to do our best as well to make sure everyone's on the same page. So again, I thank you all very much for the time. We have a website that you can go to. Again, as I mentioned, we're going to start adding these materials next week to get them prepared before the March 1st. Know that we are still doing that educational program. So we'll update our system that way as well. That's a relatively new change. You can also email our program specifically or directly if you're interested. You can email us. And if you want to subscribe to our accounts, we have two accounts. One is for recalls. So we send off recall notifications that affect Washington State products. But then you also have one that you can choose for the rule revision updates. And that way we'll be able to connect with you that way through your email account. All right, so that's great. Time for a couple more questions.
Yeah, we have a few more minutes here, so let's try to get to a couple of rapid fire ones that are still outstanding. If we didn't get to your questions, we're capturing all of them. We'll go ahead and we'll post them. We'll post the answers to the Quick Bites page that's linked in here as well too. So be sure to check out our website for that. I've got a question about the pet dogs. Does it matter if we are a closed kitchen for the pet dogs in the dining room?
So no, more than likely not. The way that legislation was written was the legislature wrote it for facilities that don't need to have a permit. And so if you have any food preparation at all inside, then you need to have a permit. And so that it would automatically disqualify you. So the only thing that you're allowed to do on premises for food production would be service of pretzels, that type of thing. So if you have a kitchen that's associated and you actually serve plated food or anything like that, that would be that you would not qualify for the indoor dog using this provision.
Thank you for that. Another question we got earlier on, will the changes that you discussed today, will they apply to brewery tap rooms not serving or preparing food?
So if they have a permit with the health department and they are considered a food establishment, then yes, these will apply to them. So more than likely the diarrhea vomit cleanup plan. If they just serve alcohol, then they don't have date marking because of that. That's not a TCS food. It's not one that has to be kept cold for safety. So there are going to be some things that apply. So to me, it's probably going to be the certified food protection manager requirement, as well as the cleanup of the diarrhea and vomit are going to be the key components of what we talked about today.
Another question we got in late, on the ground beef, can a consumer still request the temperature of a burger patty?
Yes. Yes. So undercooking in that case, they can do it with a consumer advisory upon request. If you have a consumer advisory on your menu, you can still undercook it.
Excellent. Thank you. So we are at time here at 11 o'clock. So Susan, thank you again for this opportunity to share this information with our membership, and appreciate the educational period on-ramp that's coming up here soon to make sure that everybody is getting on board for that September 1st update. Again, if we didn't get, we are capturing all these questions. So if we didn't get all of them answered today, we'll go ahead, we'll post those to our website and make sure we get those answers out to you as well. And then of course, any follow-up questions from that, reach out to us and we will help get those answers as well. Samantha, any parting thoughts from you before we end?
I don't think so. Thanks for joining us today. Remember, give your inspectors grace. They're going to give us some grace, and good luck. Let us know how we can help.
Excellent. Great. Thank you again, Susan. And thank you everybody for your time. We'll see you next time.